Her outer layer of protection is firmly in place, but Wessa Chow's anxious about taking the next step.
It's just important to understand what the side effects might be and how that might affect the body.
Working with Melbourne's Asian community, she's heard from others who also have questions about COVID-19 vaccines.
There may be people who may not take the vaccine because they just don't have enough information to make that informed choice.
Health experts say questions should be encouraged.
I don't want people to shame one another just because people have questions about that. Doesn't make them some kind of anti-vax activist.
One or potentially two coronavirus vaccines are expected to be approved for use in Australia by March, and GPs are already fielding questions.
When's the vaccine coming? When can we get out of this? And has it been developed too quickly?
The federal government has set aside $24 million for a public health campaign.
The risk with any generic campaign is that it just might not reach everyone.
In the rush to get information out during the height of the pandemic, multicultural communities received translated messages that didn't make sense. Health experts say this time around, vaccine ambassadors like sports stars are essential due to widespread mistrust of governments among some minority groups. Community forums where people can ask questions are also key, and GPs have a role to play in assuring patients the vaccines are safe.
If you get that wrong, what we'll see is the privileged getting vaccinated and those that are in diverse groups actually having lower levels of vaccination.
For Wessa Chow, she's happy to get the vaccine once her questions are answered.
In order for people to take the vaccine, people need to have the right information.
Education just as powerful as a needle in the fight against COVID-19. Stephanie Boris, ABC News, Canberra.